us.
Hi, my name is Savannah and this is my NG practice video. So before I go into the room, I will be checking the provider order to make sure that I have an order to put in an NG2. I would be assessing to make sure that there are no allergies. I'd be assessing to make sure that he has no previous damage or surgeries to his face. And then I will be providing my patient privacy. I would have already collected my materials, which as you can see I have in the room already. And yeah, so here we go. Hi there, my name is Savannah and I'm going to be your nurse today. Could you tell me your name and date of birth? Okay, perfect. So today I'm going to be putting in your NG2. The NG2 is to help get nutrition in since you've been having trouble with that and for nausea and vomiting to prevent that further. So I'm raising your bed so you can be at a better height for me. And since you were already high, you're at a good position, I will just be removing your pillow. This way you'll have an easier time moving your head for the procedure. Okay, and so at this point I would be doing vital signs for the patient. So I'd be doing SpO2 stats and just all of his vital signs to make sure that we are at a good baseline before starting the procedure. Yeah, so have you ever had any previous surgeries or damage to your nose or face? No? Okay, and do you have any allergies? Okay, so he said no to all of that. And then at this point I can be starting to get my materials ready. Okay. So this is for any drainage, if you need to spit or anything. And so is this. And so for this cup, can I just have you drink a sip real quick? And then cough. And that's just checking the gag reflex to make sure that that is all intact. And I would have a straw in here and it could, ice water is very helpful to help with the pain as well, which I would have. So this procedure will cause some discomfort. Do you have any pain right now? No? Okay, that's good. So yeah, let's get started. So I'm going to perform hand hygiene and put on my gloves. Okay. And so to figure out which nostril you want to put it in, you're going to go like this, breathe, okay, breathe, and then which nostril is easier for you to breathe in. And for demonstration purposes, we're going to say that he said his right nostril so that it can be on the same side as me. Just on the other side, I would have switched to the other side. So for this procedure, we're going to start by measuring to see how far we need to go down. So to start, I'm going to go from the tip of your nose to your ear, which is about 15 centimeters. And then from there, down to your xiphoid, or to your process, and then that is roughly 55 to 60. And so for this mannequin, and then I would also add a little bit of extra length at the end, but for this mannequin, it will only be about 45 centimeters to go into it. Okay. And so when I go in, you might feel some gagging, and so when you feel that, that is when you're going to start drinking through your straw, and then I will have you lean your head forward after that to help bring it down. Does that make sense? Okay. And then I'll also provide something just in case he feels the need to wipe his nose or wipe his tears, since that can happen when you gag. Yeah, so there's that. Okay. And I already have my tape set up to put on his nose afterwards. Okay. And now for the tubing. So I will be lubricating the tube as much as possible, basically, just because it makes the procedure more comfortable for the patient. And also, I need to make sure that there's nothing in his mouth or nose, which there's not, so that is great. Okay. Alrighty. And then before I would do this, I would want to mark where it's supposed to go down to, so I could do this with a pen or a piece of tape. There's a couple different options that you can do. And then again, normally I would write, it should be roughly in that 60 centimeter mark, but our patient is going to be closer to the 42, 45 range. Okay, so to start, I'm going to lean your head back a little ways, okay? All right, here we go. Now drink your water. Okay. And doing great, you're doing okay. And we're done. Okay. And so at this time, I would be making sure that the patient is still breathing okay and doesn't have any severe discomfort. Are you doing all right? Okay, I know it's not comfortable. Now I'm going to be securing the tubing. And if there's anything going on, I'd wipe that off. And then put our tape on the tube to secure it. Okay. Are you doing all right? Okay. And so at this point, I would be needing to make sure that my tubing is in the correct place. So I can do this by taking the gastric content and testing the pH. This would also be secured to the patient's gown. And so after doing the pH, I need to make sure it's in that normal range. And then after that, I can do the x-ray to ensure that it is in the stomach. And so I would also, again, be like assessing for pain. I would be teaching the patient that if their tubing starting to come undone, if they have any severe pain going on, that they need to let the nurse know so that we can do something about that. I would be documenting everything I did, so I'd be documenting how far the tubing is in, so it's at the 42 mark. And then I would be documenting what the gastric contents were, what the pH was, and documenting that there was the x-ray done. I would be documenting, again, how far it is, the type of tubing, how, the type of tubing, the size of it, and then I would be documenting how they tolerated the procedure. And then at the end of this, I could replace this with a better material to secure it, to make it more comfortable, and I could use a skin barrier for the patient. And so at this point, I could be cleaning up my materials and lowering my patient down to a comfortable position. And I'd want to keep them at more of a higher angle for a little bit, for the time being. Okay. Oh, and then I also, before I forgot, I should have also taken off my gloves, put on a new pair of gloves. I should help the patient perform oral hygiene, just to prevent any infections, just to make sure everything's going good in there. And then also clean out his nose as well, make sure that that is all going good as well. And I would also be documenting that information as well. And that's my video.